Assalamualaikum and hi everyone. So we are from group 3. So in this video we will explain and present about the case study entitled immunodeficiency. So the scenario given is about KD, a 36-year-old gay professional man which has been infected with HIV for 6 years. Then he received treatment which is antiretroviral therapy with combivir and elfinavir, but he self-discontinued his medications around 6 months ago due to depression. Then the purplish spots appears on his neck and arms. Then the vital signs were checked and he had been feeling fatigue for several months and was experiencing occasional night sweats. Then the physical examination shows the within normal limits, and some tests was ordered by the doctors. And then over the next week, he developed a non-productive cough and increasing shortness of breath. And last night, he developed a fever of 102 degrees Fahrenheit and was acutely short of breath. And he was brought to the emergency department and admitted with probable pneumocystis jirovecii pneumonia (PJP), which was confirmed with bronchoalveolar lavage examination under light microscopy. His admission, white blood cells and lymphocyte studies demonstrate an increased pattern of immunodeficiency compared with earlier studies. He is admitted to a medical unit and placed on nasal oxygen, IV fluid, and IV 3-methyl-pim sulfamethoxazole. So for the first question is, what is pneumocystis jirovecii pneumonia? It is a type of disease that is caused by a fungus which called as pneumocystis jirovecii. This is common in the environment and rarely cause illness in healthy people. However, it can cause a lung infection in people with a weakened immune system such as HIV. So for the second question is, what is the significance of the purplish spots over KD's neck and arms? So the purplish spots appears on the skin can be a sign of the AIDS-defining cancer, which is known as Kaposi sarcoma. It usually appears first as spots or called as lesions on the skin. The lesions can be in purple, red, or brown. KS lesions can be flat and not raised above the surrounding skin, flat but slightly raised, or bumps. Also can affect the lungs and intestines and cause swelling in the legs. Sometimes there is tooth pain or tooth loss, weight loss, night sweats, or fever for longer than 2 weeks.
The question number 3 differentiate between HIV positive status and AIDS. Firstly, HIV is a virus that can lead to immune system deteriorate. It's a virus that may cause an infection, while AIDS is the condition where the HIV virus causes. Secondly, a person can have an HIV infection without having AIDS, while for AIDS, anyone diagnosed with it already infected with HIV. Thirdly, for HIV there is no symptom, while for AIDS, person may experience many symptoms associated with the condition, for example, TB meningitis and cancer. Lastly, for HIV, it can be transmitted between people just like many other viruses, such as from one person to another through the exchange of body fluid or share needle. While for AIDS, it cannot be directly be transmitted from person to person, but someone infected with HIV may progress to AIDS. Question number 4. Why is KD's development of Kaposi sarcoma and pneumocystis jirovecii pneumonia of particular importance in light of his HIV status? Kaposi sarcoma (KS) and pneumocystis jirovecii pneumonia (PJP) is the most commonly encountered HIV-associated opportunistic infection. Both KS and PJP is important because it's a sign of his HIV is leading to AIDS. People living with HIV will have very weakened immune system are much more to develop AIDS. At this stage, the person will become vulnerable to various opportunistic infections which can attack any part of the body. Such infection could range from fungal infection and cold to disease like TB or cancer.
For question number 5, what factors might have influenced KD's developments of pneumocystis jirovecii pneumonia and Kaposi sarcoma? Firstly, he self-discontinued of his medication that being prescribed for him, which is combivir and nelfinavir. Second, he's been skipping meals, in which make his nutrition intake is not sufficient as required daily, make his body open for damage. And lastly, he might be malnourished, which make him susceptible to get sick more often, which can lead to AIDS develop quicker. For question number 6, identify 4 problems you must manage regarding KD. Firstly, make sure he get enough nutrition intake. Second, taking good care of hygiene such as hand washing whenever handling him, and ensure he will not getting sick even more, because without good hygiene, we possibly transfer more harmful bacteria toward him. Third, treat his pneumocystis jirovecii pneumonia and Kaposi sarcoma from getting any worse. And lastly, managing his fever and keeping him from getting worse.
Question 7. What precautions will you need to use when caring for KD? First of all is to practice hand washing. This is to make sure he is not susceptible to any other infections. Secondly is to discard any used syringes into a biohazard bin because we know syringes can carry the risk of contamination of the HIV virus. Thirdly is not to share any personal equipments or foods with KD that could carry the risk of transmission of the virus. And fourthly is to ensure a clean and proper hygiene environment where KD will not be easily exposed to any other opportunistic or dangerous pathogens.
Question number 8. What is the focus of your ongoing assessment? First, monitor his pulse oximetry. Second, monitor his body temperature. And third, monitor his breathing and respiratory status. We move to the question number 9. What major side effect of his antibiotic should you monitor KD for? First, monitor if he has trouble breathing after getting his antibiotic. Second, monitor if he has sore throat and cough. And third, monitor if he develops any unusual bleeding after getting his antibiotic. Question number 10. What aspect of KD's care can you delegate to the licensed practical nurses LPN? The bold one is the aspect that can be applied to the KD's care. A. Administering the first dose of IV trimethoprim sulfamethoxazole, Bactrim. B. Monitoring KD's pulse oximeter readings, reporting values under 95%. C. Developing a plan of care to improve KD's oxygenation status. And F. Repositioning KD and having him take breath every 2 hours.
Question 11. KD is kept on trimethoprim sulfamethoxazole, or also known as Bactrim under its brand name, 2 tablets once daily. He asks why he has to keep taking the drug since the pneumonia is gone. How would you respond? First of all, he should be taking the Bactrim drug, which is a broad-spectrum antibiotics. And this is because there is a possibility that the pneumonia can reoccur if he stops taking his medication halfway. We want to ensure that the fungus which is causing the pneumonia, also known as pneumocystis jirovecii, that causes the pneumonia to be completely destroyed, which causes the inflammation in his lung tissue. If he insists on discontinuing the drug, he is encouraged to take on the antiretroviral therapy, also known as the ART therapy, to completely kill the virus.
Question 12. Give at least 4 additional topics that should be discussed with KD before he goes home. Firstly, discuss with KD about the side effect of his medication, for example, fever, nausea, vomiting, and skin rash. Secondly, look for signs if a new infection occur in KD so that the new treatment can be given to him. Thirdly, suggest KD to optimize or boost his immune system by practicing a healthy lifestyle, getting enough sleep, and applying a good hygiene to avoid him from infection. Fourth, educate and explain to KD about the consequences when he stops antiretroviral therapy or his medications again. For example, patients who stop ART will slowly develop a weaker immune system. Question 13. What laboratory data will most likely be monitored in KD in the future? First of all, full blood count to check for inflammation and infection. This include WBC, RBC, platelet count, and hemoglobin level. High WBC means the body is fighting HIV infection. Low RBC and HB is common in HIV patients, suggesting anemia. This could be due to side effect of HIV medication and Kaposi sarcoma. Low platelet count commonly associated with chronic HIV infection. Secondly, basic biochemistry tests to check for inflammation and evaluate functional capacity of organs. These include renal, liver, and electrolyte profile. Commonly, HIV patients will develop renal failure. Thirdly, CD4 cell count also can be used to evaluate the immune function in HIV patients. If the count is more than 500, it is considered as normal. If the count is lower than 350, HIV has damaged the immune system. And if the count is lower than 200, patient is at risk of opportunistic infection. Fourth, HIV viral load test also can be used to measure the amount of virus in infected person and to monitor the treatment. Normal result means no virus found. Low viral load means virus is not very active and treatment is effective. And high viral load means virus is active and treatment not working well. And the last question is list at least 5 other opportunistic infections that KD is at risk for developing. Number 1 is candidiasis, which is oral opportunistic infection. It is an important marker of immune suppression and may be initial manifestation manifestation of the disease in about 10% of HIV infected adults. Number 2 is tuberculosis, which is a disease caused by bacteria Mycobacterium tuberculosis. HIV patients are more likely to become infected with tuberculosis due to weakened immune system. Number 3 is meningitis, which is inflammation or swelling of the protective membrane covering the brain and spinal cord. People living with HIV are high risk of getting meningitis. Number 4, lymphoma, which is a cancer that begins in infection-fighting cell of the immune system called lymphocyte. Burkitt lymphoma is the most common lymphoma in people with HIV. Number 5 is pneumonia, an infection that inflames the air sacs in one or both lungs.